I am so proud of our college and the accomplishments we have reached together this year. We are continuing to move forward with the goals of our strategic vision. In the videos that follow, you will learn more about our Primary Care Innovation Fund that contributes to entrepreneurship in the Philadelphia and Atlanta communities and around the nation. Our commitment to diversity benefits the college's intellectual life and the healthcare profession. Our expanding academic programs, facilities, and clinical training network, which are models of educational quality and opportunity. And our latest research initiatives, collaborative work, and scholarly outcomes. Each of our achievements defines our college for the next decade and beyond.
The PCOM Primary Care Innovation Fund is a big deal. It's a big foray into the world of innovation, but it's also unique beyond PCOM. The PCOM fund is structured as a traditional venture capital fund. It's one of the few medical schools out there with a fund. It's one of the few academic institutions out there with a separate, independently structured venture capital fund. The Primary Care Innovation Venture Fund, broadly speaking, targets primary care innovations, things that are connected to improving patient outcomes or physician practices or physician and patient satisfaction. Primary Care Innovation Fund is focused on investments from an array of sources. We're really national in scope. We're looking for healthcare innovations that come from all pockets of the country. Our advisory board was put in place at the commencement of the fund to help with a number of different areas. They help us with deal flow in introducing us to potential investments. They help us with diligence and their expertise, and they'll ultimately help with working with companies that we invest in to help them to grow, help them with their strategy. The Primary Care Innovation Fund is a $5 million fund that is focused on making investments in the range of $250,000 to $500,000. That's the initial value of the investment. Over time, we expect to have anywhere from 10 to 12 investments in this first fund. That is really the focus of this fund, first and foremost, is to help grow the endowment of PCOM.
The fastest growing segment of the United States is Hispanic Latino population, but yet only 4% of Hispanic Latino practicing physicians identify as being Latino. So that's one of the reasons why we wanted to reach out, particularly to low-income areas, to motivate these students to envision a career in science, technology, education, math, and medicine.
Our students in our Latino community have the same talent, the same potential as students anywhere else. We know that there's a cadre of students that are already walking in a pathway, defining their future, and they can see their own success. PCOM is family with Aspida. I mean, we have come together to really talk about the alignment of what it takes to grow a successful student.
We've had the awesome opportunity to bring our students to the anatomy lab. I always remind them, not everyone at a college level gets the opportunity to visit an anatomy lab. Many times it's not unless you're in medical school. I do believe that children are born very inquisitive and that they're driven to science and to exploration and to learning about different things, including the human body and everything that has to do with health.
The U.S. Department of Labor statistics have predicted that physical therapy is one of the fastest growing professions in the healthcare field. In fact, it's in the top 5 with an expected or projected growth of somewhere around 36 to 39% over the next 5 years. In the state of Georgia, there are approximately 300 jobs for physical therapists that go unfilled each year. Most of those are in the south part of Georgia, where there is a real need for healthcare workers. And so we're hoping to focus in that area by recruiting students, but also in developing clinical sites. And we certainly are adopting the philosophy of the osteopathic profession and looking at the relationship between musculoskeletal system and the whole being or the whole person in terms of their health.
I was born and raised in Georgia, as was most of my family. I feel it is my duty to pour back into a community that has given me so much thus far in my life. I come from a small town where it was underserved, and so I know firsthand what it means to live in an underserved community. I believe that our PA program has become kind of a little family to us. Not only the 20 students that we have, but also the faculty members that we are interacting with every day. They go above and beyond really to coach us and to give us constructive criticism to keep us on that straight and narrow path to our ultimate goal, which is becoming PACs. We're not only in this program for ourselves, but we are here for each other.
PCOM's graduate medical educational programs have been ongoing since roughly 1946. We take pride in the excellence of our programs. The residents are hardworking, but they get graduated responsibility. They learn by doing. Large patient populations, meaning a great pathology, a number of different surgical procedures, etc. And we're pleased that we do our best to make sure that there will be excellent graduate medical educational programs in the foreseeable future. Currently, we have roughly 135 residents in 15 programs. Our own GME programs are continuing to evolve and to develop our applications to work toward ACGME accreditation, since we all have to be ACGME accredited by the year 2020. Our sponsorship for the PCOM programs is pre-accredited. Our orthopedic surgical residency is pre-accredited. Our general surgery program was the initial program in the country to receive initial accreditation, pending the full initial accreditation of the sponsorship program. And our ENT residency, internal medicine residency, and our neurosurgery residency have all been inspected and are awaiting status as to pre-accreditation.
The center has two simple functional parts. That of standardized patients. That area has been doubled in size, and more importantly also upgraded in technology so that everything is electronic online. The students therefore are asked to practice and learn these skills in the environment that they will soon be participating in today's medical world out in the hospitals and the clinics. As far as the simulation center, that's the models, a lot of people like to call it, that interact with the students. They have blood pressures, they have respiratory sounds, they have heart sounds. You can perform procedures on them. That has expanded now to an area where we have a specially designated OBGYN suite. We have an area that simulates an emergency room and or a trauma area. And then we actually even have a dedicated section for smaller skills necessary for a physician to learn, such as intubation, starting intravenous lines, etc., and multiple training stations there.
The mission of the Division of Research is to facilitate research activities on both of PCOM's campuses and our clinical affiliates. The priorities of the DOR were purposefully aligned with the educational mission of PCOM. The goals of our training programs are to spark curiosity in the students, hone their skills in critical thinking, and also to inspire them to continue to contribute new knowledge to their profession. Our basic scientists study the functions and diseases of the cardiovascular, pulmonary, urorenal, visual, and nervous systems. Other of our faculty, particularly on the Georgia campus, are involved with drug and biomarker development. And then finally, our faculty have been doing morphological analyses to identify factors that impact the development of multiple species. Regarding clinical research, one of our priorities is to establish partnerships with healthcare providers to develop and test new strategies to treat diseases, as well as slowing their progression and preventing disease recurrence. I am truly excited to be back at PCOM. The scope of research and administrative support for research has expanded tremendously over the last 10 years. Our division remains committed to supporting the research of our scientists, educators, and clinicians, and ultimately this will promote the careers of our students and improve patient care.
Osteoarthritis is a disease that affects pretty much most of the population over the age of 60. It is often a result of an injury earlier in your life. It also can just be from wear and tear. We have been working on a new class of therapeutic that we have created, for which we have a patent, and we are testing it in animal models. It's a technology that is unused to this date, and it is actually a way to interfere with the enzymes, which are proteins in the cartilage that break down the cartilage itself, which is the hallmark of osteoarthritis. So everything that's out there right now is symptomatic pain relief, temporary relief of pain, but no long-term disease-modifying option, and we really feel that what we're using now has that potential to be disease-modifying. Osteoarthritis is so hard to study in the lab because the joint is made up of several different tissues that interact. And so having this three-dimensional modeling, which was very computer-based, gave us a chance to play with multiple options and then focus it the ones that would be the most beneficial targets for osteoarthritis. Finding a solution long-term for treating osteoarthritis is really relevant in our society today because we live so much longer, and because the hallmark of osteoarthritis is this sort of wear and tear that we see in normal living an aging population is going to have a higher incidence globally of osteoarthritis.
Multiple myeloma is a cancer of plasma cells in the bone marrow. Even with the current technology and advance in chemotherapy and transplantation, this disease is still incurable. So my goal is to find a potential drug candidate that can treat, or in combination with the current therapy, to ameliorate the symptoms of multiple myeloma and hopefully to improve the quality of life and survival of the multiple myeloma patients. This grant is provided to all the junior professors at the assistant professor level and to help them to get some preliminary data so they can use the preliminary data to apply for bigger grant from NIH or even pharmaceutical industry. And this grant is very competitive, and this year I was one of the 14 recipients.